Welcome back to MITA Unshackled, back here at the Emerald Scientific Conference in beautiful San Diego, which you can't see behind our non-transparent shade here. But we have a beautiful view of the bay, which we will enjoy. Dimitri Downey again with,
Destiny Blanco.
and we have an amazing individual, so we're going to get right into it. We promised you the most interesting, thought-provoking, intelligent, inspiring individuals in cannabis. And I've had a brief opportunity to get to know Jeffrey Keller here a few minutes before. But our goal obviously is to make sure that people out there who watch these podcasts who aren't able to come to these events are meeting people and networking with them, being able to reach out to them at a later date. And I'm sure a lot of you will be reaching out to Jeffrey after we get a little bit about who he is. How you doing, Jeffrey?
I am doing great. Happy to be here. Really appreciate the invitation.
Thank you for joining us. Do you enjoy the conference so far?
I have. It's my first time attending a cannabis conference, and this is a really amazing first opportunity. I think I'm starting off at the cream of the crop.
There's definitely the peers here. I wouldn't say my peers because they're above me. So your peers here are just extraordinary. The level of thought and their skills and knowledge, etc. We're extremely, extremely honored to be here amongst them, and of course Destiny too.
No, I'm learning so much. You guys are amazing.
She's like in here stealing patents and stuff. She's like, that's funny.
It says here you have a PhD.
I do have a PhD. That is a fact. Yeah.
So let's get into your journey. Like, how did you get your PhD? What's your PhD in? And then we'll go into cannabis.
Very unusual track. So, started college, was going to be a soil scientist, and turns out that there was no summer jobs for soil science that paid. And so I was walking around campus at the University of Kentucky and happened to come across the need for a lab tech in the Center on Aging there. And so I started as the undergrad, and I left as the assistant director of the Alzheimer's Center there. And
by the time you graduated?
I graduated and hung out for a few more years, got to be a professor, and became the assistant director. And then I moved to Louisiana to go and start my build an Alzheimer's Center from the ground up. I had a lot more hair then and a lot more energy, still work a whole lot, 7 days a week. But back then I had a lot more gumption and was lucky enough to have investors and the opportunity, and built an Alzheimer's Center there. And so my degree is in molecular cell biology, but I've been lucky enough to do the every aspect of clinical trial work. So everything from the designing of drugs conceptually to preclinical drug development. That's where you use in computer modeling, as well as cell culture, as well as mouse studies, rodent studies.
Was it in vitro as well, right?
In vitro and in vivo, and then moved on to doing.
I know the big words.
There you go. Doing clinical work, and designing clinical trials, running clinical trials. Been NIH funded for 20 plus years continuously. Worked with all the major pharma groups, and so.
The NIH funding was in Louisiana.
No, been NIH funded my entire career. So
it's Kentucky and Louisiana.
And how I got into the cannabis space was one of the clinical trials that I'm a part of is called the Libby study, and your viewers, I'm sure, would really enjoy learning about that. It's a study that was started by Dr. Jacobo Mincer out of South Carolina. It's the largest THC clinical trial in the United States, and it was centered based on the benefits that an individual who was dying, that Dr. Mincer knew had benefits from THC use during their life's journey, and he was able to get this 15-site NIH-funded trial for THC for the treatment of agitation in hospice-eligible dementia patients. That's a lot of words, but
2018, 2019, when did
that actually was funded in late 2019, early 2020, and we are it was in 2020 that it was funded.
Right.
And we will be seeing our first patient in April of this year. And so it took over 2 years working with the NIH, the DEA, and the FDA to actually source the THC for that trial. And I was lucky enough to be a part of that effort. And that ultimately led to me getting an ISO accredited laboratory in the space. We're the only analytical laboratory in the state of Mississippi for medical cannabis, and we service the entire state there. And I'm focused on developing standards within the laboratory to help get medical cannabis on track for drug development in the United States. And I'm focused on helping, based on my research experience at all levels, helping to get the level of research in cannabis at a higher level. And we're going to do that through multiple avenues.
There's so much to dig into. But first of all, because people are probably Googling Libby study, it's Libby.
Sorry, Libby. Yeah, if you just do Libby and THC, you'll see it's the Libby study. Yeah.
Excellent. Wow, there is so much to dig into. Just to let you know a little bit about my background, I'm a kind of a regulatory policy guy. I've been involved in the industry for 10 years, built out dispensaries, tried my hands at cultivation, a bunch of other things. So the accredited laboratory world is a little bit complicated and difficult for me, but...
So you're saying you're more than just a model?
Yeah, thank you.
Okay.
Well, she's the beautiful one.
I'm learning here.
But I did help start the Lab Association in Arizona, and I do understand the importance of laboratory testing in cannabis. Arizona, of course, was one of the states that started without a laboratory testing program.
Mandatory testing now.
Which is interesting.
Since 2017.
But
then one word.
So it kind of happened in reverse. And it's going to be fascinating to talk about what might happen federally.
Yep.
And that we'll get to that towards the end, because that's all speculation, but fascinating speculation nevertheless. And somebody of your level of knowledge might have some better insights.
Well, are you familiar with what I was here to speak on today? It's just too many dang words. The Medical Marijuana Cannabidiol Research Expansion Act.
And then this is what we should talk about, because like the viewers out there, we are out here as well. In there are all the people that get to hear you speak.
Yeah, Yeah. So that was my main impetus for being here.
Sure.
Was to speak on that. And so in December 7th of last year, 2022, there was the first legislation focused solely on cannabis passed, and it's called the Medical Marijuana Cannabidiol Research Expansion Act.
Federal legislation.
Thank you. And it does several things. The first thing that it does is provide a beautiful roadmap from which to follow now for future cannabis legislation. The fact that it went through the House, the Senate, and the President, it provides a nice pathway forward. It does many things. So the first thing it does is streamline research. So it should, in theory, take the 2-year process that it took for us to get the NIH study, the Libby study, up and running. It should shorten that time frame. What's less clear is how it's going to help with non-NIH funded studies, because it still allows for the Attorney General and the Secretary of Human Health and Services to, if they can still deny research applications based on concerns for public safety, as well as concerns on the qualifications of the investigator. And so while it's helpful on that front, we're going to need to keep a close eye on it to see how much it really streamlines. The other things that it does is it absolutely allows physicians to speak to patients for the first time on the benefits and risk of cannabis for their particular situations. And that's been something that's held up the field of cannabis research as well as cannabis therapies for quite some time. A lot of health systems do not allow their physicians to speak on it. There's no federal restriction on that now through this act. The other thing that it does is it requires the Attorney General to develop a registry of medical cannabis. There's currently 7 sites to have an uninterrupted supply of medical cannabis for research. The other thing that it does is that it requires the Secretary of HHS to report to Congress annually on 5 things. One of them is the benefits of cannabis towards specific medical indications, the effects of cannabis on human health, the effects of cannabis on childhood, adolescent brain, and the effects of cannabis. What is that? Oh my lord! The cannabis on. Need to go to my dementia center here.
No, it's all right. Yeah.
No. This is the important. This is the important one. They're all important, but this is one in particular. It also requires them to report on the accuracy of cannabidiols in products that are consumed by the public,
Okay.
as well as research products. And so what that does is that sets the framework for finally addressing one of the huge problems in the lab testing, which is the inflation of cannabinoid numbers, which
Right.
we know exist and needs to be addressed because not just for RICO issues and other types of things, but it needs to be addressed because we need to know what people are taking and the benefits and risk of what they're taking in an accurate way. And so that, in a nutshell, is what I spoke about in there and the implications for that. Would you like to hear about the?
No, absolutely. I'm just trying to think where this is taking the cannabis industry, where this is taking the cannabis world.
Let me walk you along.
No.
So
I'm going to change it to Professor Keller. I'm just going to call you Prof here.
So I've been called worse.
But you are a professor.
I am a professor. Yeah. So
Professor Keller.
So the other thing that it does is it lays the groundwork for some very immediate things to happen. So one is the IRS 280 exemption. So right now, medical cannabis establishments can only deduct the cost of goods as part of their tax deductions. The federalization of research and development for cannabis and its derivatives seemingly would lay the groundwork pretty definitively for there to start to become tax deductible research and development in the coming year to years. That's one. The other thing that it does is it provides an impetus for standardization of procedures and terminology. This field doesn't even have, for example, what is a dose? We don't even have a definition for what that is. What is an appropriate patient? We don't even have that. So this requirement for reporting and requirements by the MCREA, as we're calling it, lays the groundwork for that. The other thing that it does is that it will help to develop centralized databases to accelerate research. Because the government is going to be required to report on these things, and development of these databases are absolutely key to the maturation of any scientific field. So I anticipate that that's going to have a really dramatic effect. Now, what it doesn't do, and what's still really needed for this field, is peer-reviewed research. Right. So there needs to be scientific journals reviewed that are appropriate for this field. People submit dozens and hundreds of papers a year to established scientific journals, and to be quite honest, they have limited effects on the field, and they're not cited in this field.
Right.
And so we need a new way to do that, and peer review is beautiful because if it's done in the correct way, where it's blinded and followed, what it allows you to do is have an immediate validation of results. For example, having your peers say that something is appropriate, is the correct way to do something, is a new finding. That provides an immediate validation for that method, that investigator, that type of approach. And you can judge the impact of that long-term for validation based on the number of times that it's viewed, the number of times that it's downloaded, the number of times that it's shared, and the number of times it's cited. So I am very excited that all of this together is the dawn of a new era for medical cannabis research, and I think this act is very important as a catalyst, but we still got a lot of heavy lifting.
No, this is fantastic. I'm thinking I wish you were in charge of the NIH during COVID. I'm just saying, some peer review research, some double check, just I'm just saying.
I'm not going to walk into that
That's a whole
quagmire.
other podcast. That's
You don't have to, but now, but we see.
I don't have to, but you'd like me to.
No, it's okay. I wasn't going to point out that in 2020 Trump was president, but that you just mentioned
Who is that? Yeah, I
in
don't
2020.
know. Yeah.
I'm gonna sip my tea.
When the good things happened in cannabis. Sorry, I got way sidetracked on that. So most of the people who watch our podcast are consumers, patients,
Okay.
industry members. They own cultivations, they own manufacturing centers, they own brands. They're C-suite management for dispensaries. And they're looking at an individual like you and what you're talking about and your level of expertise and thinking to himself, well, we better understand what he's saying, and we better understand where the federal government is going to be taking cannabis. But what does it mean for us? How do we get ready for this world and what's going to change? You see what I'm saying? And no one really knows, but you might have a better idea than most.
Well, it's not reinventing the wheel. So
And they're scared.
They're scared.
I think they are
I think
scared.
they've been frustrated by the lack of research. When I look at MJ Biz and other types of things, about a third of the articles include the phrase, but more research is needed. I think
Definitely.
that this is, and so much of it is anecdotal, so much of it is speculated. It is a field that is starving for research. I believe that the field can't advance, to be quite honest, unless there becomes a more meaningful research set of programs throughout the entire industry. And when you say
some people are scared, I'm just saying that's not necessarily a
well,
bad
change
thing.
is scary.
Yeah.
Change is scary.
And there's a lot of companies that are operating out there without research, and though things are just fine. Personally, I want research for my thing. I want research for aspirin. I want research for COVID. I want research for a lot of things.
Yep. Data driven. Data driven is good.
Data driven. Yeah. So that's
you can make your determinations based on data.
But the whole industry, state by state, country by country, is being set up with a lot of data, without data, with all anecdotal based, experiential based decisions, and they're creating brands. They're doing cultivations.
I would say all states and all countries. Yeah,
so along comes medical driven decision making process. It's going to change things.
So let's take it to something that's very practical. So one of the services that we're offering, feel free to use others, although I'm not aware of any others that exist. But one of the reasons we're starting a preclinical program is to address just what you're talking about, Dimitri, where how do you educate someone on how research could help them or why they should consider it? You can do for several $1,000s, not tens of thousands or hundreds of thousands of dollars, you can investigate in appropriate models the ability of your molecule, your extract, your given thing to actually have an antioxidant effect, to actually have an effect on muscle growth, to actually have an effect on synapse formation, to have things that we know that we can measure that have implications for human health. So doing those types of experiments does a couple of things. One, it can help you with formulating. So instead of being hypothetical in terms of what two things in a thing are going to do, you can actually show some evidence that, at least in these models, that they do or they do not work in a certain way together. The other thing that you can do is you can do studies so that you can raise the money perhaps to do a clinical study. That's another reason to do it. Another reason to do it is so that you can differentiate your products.
Credibility.
While you cannot do medical claims, you can certainly say that the addition of this versus placebo increased synapse formation by 20%, 100%, whatever it is, compared to the placebo. Or you can actually start to look at receptor-mediated versus non-receptor-mediated events. Don't want to get too technical here, but it's pretty easy, I think, for people to conceptualize, here's an entry point where someone is going to hold my hand and walk me through and start to allow us to collect data so that we can make better products, differentiated products, and to have a pathway for clinical work. And the reason why I'm doing this is because I think that is what is going to, we not only need all of this infrastructure set up, we need to actually have people out there that have companies to help the people who want to change have the ability to do so. And those are going to be coming online, not just through me, but through other people.
Now, are people reaching out to you, like saying, help us develop products?
We just started this effort. Yeah. So I'm dying to have people start to contact us about that. And one of the beautiful things is, as I run a testing laboratory, we can do very detailed work on what we're treating cells with, and we can help people to maybe improve their product that we're investigating. So it's not just a one-stop shop. And I welcome any and all people to contact. And we would like to work with consumer groups, so people that have suites of products, and we can help them consider how research can be helpful to them. There's also things that you can do that are low-cost clinical.
That's huge, by the way. I mean, that the people who have suites of products should be coming to you and saying, look, we want to take things to the next level. Absolutely. I love that. I love that.
The next one is you can help people. There's also basic research and development that can be done that in most other fields is part of marketing. Marketing research. A lot of that is R&D that's needed in the cannabis field. What is the profile of people that use vape cartridges, for example? How do they differentiate from people that use edibles? What are they using them for? What are their preferences? What are their aversions? So this is not only marketing material, this is information that's very valuable on just a basic research basis. And I guarantee you that most of the companies that are out there making these carts and edible products, they assume they know who their market is. They assume that they know why people are using the products. But I believe that they shouldn't be scared to find out who and why they're using these products.
Right.
But I believe that when they get that knowledge, they'll be able to make a better product, and they're probably going to be surprised in a very positive way.
Definitely.
Am I speaking too much?
I think those companies that have that angle, those people that market just the soccer moms that need those certain energy bars or the edibles and stuff. So the precise dosing is what's important.
That's very important. We did a study in Louisiana when I was on the State Board of Medical Examiners, and looking at I believe it was 1,800 people in the dispensaries, and we found things like that men and women are the dispensaries give different dosing, different types of recommendations to females versus males. There's a lot of inherent biases for these things. And so, again, this field needs more data on everything.
No,
and it's not just to,
sorry, go ahead.
I don't know how you can argue that, I don't know how someone could argue that this field knows what it needs to know at any level. It's just there's so much that needs to be done. And so that shouldn't scare people from starting, is what I hope it does.
Yeah.
And definitely. So there's people like myself out there that are trying to walk people through, and all it takes is a phone call.
No, honestly, I mean, I've been wrestling with this since the 10 years. I'm an ex-prosecutor. I was an epistemology major at Boston University. I put people in jail, took away their freedoms. I got in this field in 2012, and I've been wrestling with this very notion of medicinal marijuana versus adult use marijuana, adult choice. I don't like to say recreational.
Remedy versus
how it works, the science behind it, where are the adults in the room, why are the scientists we know why the scientists are studying it. When will it get there? When will we have a better understanding of how how the plant works?
So just take something like one of the things I forgot to mention.
And just one thing. So when I got in 2012, and I started working with a lot of people who are consuming actively, and I met individuals who were writing dissertations during the 9 to 12. They'd go outside, they'd smoke a big old blunt, which would put me on the floor if I smoked it, and go to sleep. Then they came back in, they finished writing their dissertation, editing their newspaper, and it started doing something to their mind, which is helping sharpen their focus. And then I started meeting businessmen who would tell me that they were doing the same thing, because my name got quickly associated with cannabis legalization, the cannabis movement. And I met individuals who were running companies with 500 employees who were like, if I didn't have my cannabis to relax at night, you wouldn't see I wouldn't be during the day who I am and who you know. And I'm like, what? And then all my friends from law school started popping out saying, Dimitri, we were using it while other people were using Adderall. We were quietly using cannabis in the 90s to relax and to focus. And I'm like, what the heck is going on scientifically, data-wise?
Mm-hmm.
Where is the science? And it sounds like you and your or you guys are on the tip of the spear of doing this in a way that's going to be really, really credible.
Yeah. Oh, it's definitely credible, and it's just we're looking for the applications. So applications meaning have customers, have people come to us and develop protocols and different things to address their needs. I do a lot of CMEs, continuing medical education events across the country, and what you were talking about there, even something like the intoxication effect of something like cannabis, very difficult to do.
Yeah.
There's no relation between the levels in the blood.
What does it mean to be intoxicated too? I want to,
Well, yeah.
Can you get too high?
I mean, she's intoxicated right now, but she's as sharp as ever.
It keeps me calm. I like indica, so.
Yeah, I mean,
and that difference too. Indica versus sativa. I'm sure that's a big part of your guys' clinical trials and learning.
Not yet, but it needs to be.
Okay.
Yeah, no, it's just a straight up THC with CBD versus placebo, and for this particular trial. But they're very primitive to where they're going to be in the future.
So yeah, definitely. I know that cannabis right now, we don't really know. Like cultivators talk about it all the time. They don't know. Do we truly know the difference between indica, sativa, and is this plant, that they are growing?
We'll just keep going extra few minutes. Okay. That's all right. We have time. This is interesting. No, because both.
I don't want to make Eric mad. Eric keeps going like this.
No, we're trying to keep them all at the same time.
Who's my boss? Is it Eric? Or
no, it's a team effort, but we're trying to keep them all at the same time. But it's okay because this is a very interesting topic, and I think I was talking to Bo Jackson's people before the Super Bowl, and they're doing a CBD thing, and I was trying to get them to go over to the Sonoran University. Because they were going to do in vitro studies over. The Sonoran University is doing studies and stuff, and they're just getting started. They've got an institute. It's not NIH funded, so it's not at that level. But I was telling his executives from his company, I'm like, look, get the credibility with your product. So Bo Jackson has something. That's the kind of people that should be going to you.
Yeah. Yeah, and I don't want to downplay other people.
No, they're good too.
Folks, but
they're not NIH. You guys are the only NIH.
Well, that's with the clinical trial. So that's with I'm a part of the largest clinical trial for THC in the United States. We're setting up preclinical studies within my clinic. Within my laboratory in Mississippi, doing fee-for-service work with an emphasis on walking the client through the easiest means to do preclinical work in cells, work in test tubes, to get the data that they need to differentiate their products, to get the funding that they need for a clinical trial, to get the funding that they need for the development of a whole line of products, and formulation that's based on data, not whimsical
anecdotal experience.
Anecdotals, yeah.
Yeah, but Destiny's pretty comfortable with the anecdotal experience. Anecdotal experience has saved the lives and the sanity of millions, if not billions, of individuals over the last 50 years. And prior to that, since the beginning of time. So there's good and then there's better. And then we should get to better.
Ooh, I like that.
You see what I'm saying?
Yeah, and
he likes something I said.
No, there is. There is something.
I was fishing for a compliment the last 25 minutes.
No, and I would say also that you also need to think about there's traditional drug development, and then there's going to be a role for cannabis within that traditional drug development role, like we're doing with the NIH study. But there's also a role for non-traditional, because this is a unique experiment the United States is doing, where we have 33 states that have said you can use cannabis for these indications, and no one has systematic with the passage of MCREA Act. Now is the time to put in place the open label types of studies where there's not placebo controlled, but we do the work in these states where we collect the same types of data so that we can compare whether or not different types of cannabis, whether they be the different strains, different varieties, different whatever genetics, that whether they do or they do not have effects, both positive and negative, in different populations.
Right. And there's different types of ways to consume cannabis, like cannabis beverages. Yes. Cannabis beverages just kind of started in the last 4 or 5 years.
Yes. Yeah. And so things like sublingual strips, very little of that is done. It it's frustrating and it's exciting for the same reason. It's in its infancy, and I'm just happy to be a part of it. Happy people that like yourselves are educating people on it, and I hope that folks will call us if they have any questions or any interest in trying to do research.
No, I'd love to connect you to Susan with the Sonoran University.
I met Susan here. Yeah, I met her here.
Beautiful.
Yeah,
Could you educate could you educate a university president on this? If I connect you with Bobby from the U of A or
well, I do
Michael from
CMEs
ASU
all over the place. So I have, it's not uncommon for me to have the head of neurology at a major medical institution say, "This is what I tell my patients. Is this correct?"
I'm going to connect.
So there's a whole there's a lot more work that needs to be done on this.
Yeah,
I'm going to connect him with Bobby from the University of Arizona, who about 4 or 5 years ago, I forgot how long it was, before COVID, I sat down with him. I said, "There's $60 million sitting in the state coffers from the medical marijuana taxes. U of A could dip into that and start studying the hell out of cannabis." And you know what he said? He said that's an interesting idea, and they never did anything about it.
But the place that
But you know why he didn't do anything about it? Because it was me. But if he talked to you, he'd be like.
My favorite, what I tried to mirror with the resources that I had available, I think that the Barrow Institute in Arizona is the most amazing Alzheimer's institution at every level, from what they do for patients, caregivers, to the research that they do, the care that they give. Amazing place. Would love nothing more than to help.
Is that under U of A or ASU?
I believe it's under U of A.
Probably, yeah.
Most medical Barrow Institute, amazing place.
Barrow Institute. I'm going to shoot you an email. I'm going to say, after speaking with you, your level of expertise is clear. I tried to break through our university president. Here's a proposal I gave him. Maybe you can get through to him. Enjoy your conversation.
Happy to do it. And again, happy to talk to any of your viewers who want to talk about basic science or clinical science to help their work.
Yeah, no, honestly, I can see us working together in the future. MITA USA is going more towards brands, and working with big brands and people who want to develop big brands. And, there's
differentiate.
There's medicine, and then there's just
nutraceuticals. We don't have to reinvent the wheel. And there's evidence-based nutraceuticals.
Yeah, but even like, Tylenol, which is studied to
Eric
no end.
Eric is having a heart attack.
We got next person. Yeah, so we're gonna have him back for a full hour on another episode of MITA Unshackled. There's a lot of interesting people. The Emerald Scientific, our Jeffrey Keller. I love that name. Is one of my buddies from high school.
How do people get a hold of you?
They can get a hold of me. Y'all don't make that available to them. So
LinkedIn.
No, I don't use LinkedIn.
Okay.
My email is Jeff JEFF at rapidanalytics-ms. For Mississippi.com. So that's Jeff at rapidanalytics-ms.com. Give my phone?
Yeah, well, you can call. I'm going to have a cell phone in my pocket, 520-909-4334. Everybody knows my cell phone number, the entire industry.
And let's get this next speaker on. I really appreciate the time.
No, I just realized that's what he was most worried about. Sorry, Eric.
All right. Thank you.
Thank you so much. That was another episode.